Buongiorno. I've decided to make a video on my I Choose Life card. And this won't be a video that everyone's going to want to hear, because I will maybe give some explicit detail of the life-threatening situations that I have been in, that after they repetitively happen to me, I find myself having a hard time climbing out of the hole. And that's when I started to come up with the terminology I choose life, because nobody can really say anything to you when you've had these life-threatening experiences. You can't even say anything to yourself to rationalize it, justify it, to not become phobic, to not become afraid. And there is no rationality. It's life. And it's not fair what happens to all of us and some of us. Why do some people get away without health issues or birth defects or bad childhoods or good childhoods, and the rest of us seem to not have that? So I Choose Life is my I Choose Life card. I can tell you, I'm just going to flip over them, and I'm sure they'll keep popping up as they come. I was misdiagnosed with my heart defect for 5 years after my second daughter was born. I knew I had a birth defect at the age of 4. My mom kind of kept it from me, had me checked through the age of 12, and then it was never brought up again. She never really explained to me what it was. I just remember going to these visits and not liking them. And then on her deathbed, she said, "Will you promise me to get your heart checked?" And I'm like, "What are you talking about? What? You're dying. You're in and out of a coma." And sure enough, I had my first baby, and my mom died, and I went and got my heart checked. And I remember them, when they were doing the ultrasound, said, "Well, look at how eccentric her heart valve is. That is quite eccentric." And I kept thinking, well, that doesn't sound like a normal everyday medical term. So that's when I learned that there was an issue, but they downplayed it. And then after my daughter was born, well, actually, before she was born, I was on fluid overload. My jugular vein was jumping, and my heart was at risk during the pregnancy. In the last stage, I was on 100% regurgitation. Okay, a C-section was decided to have, and I had the C-section, got my heart checked after it, and the medical doctor screwed up, and my heart was not checked then for about 5 years, because they said everything was fine and everything wasn't fine. I finally got to a point where I put my foot down to demand my heart be checked, and they were telling me in the weeks I was leaving for Italy, this was 2006, and he said, "Yeah, okay, we got a couple of problems." The one doctor had said that the birth defect had reversed itself and cured itself. The second doctor said, "No, you don't read it that way. In reality, it's severe. It's about to blow," but he didn't want to tell me that. But he said it was very, very severe, and we're going to see you. Go ahead and go to Italy. Enjoy yourself, and we'll see you when you get back. While I was in Italy, my Italian lover boyfriend, his brother, was kind of like a doctor and said something's wrong with her heart. And I kept saying, no, the doctor said it was fine. And the boyfriend's brother said she's going to have heart surgery. I said, "Oh, what are you talking about? I'm fine. I'm an athlete, you know?" And lo and behold, I got back to the States after this 4.5 month trip, and I had emergency open heart surgery. Okay, the surgery went well, except for coming out of the surgery, I woke up. The surgery was delayed, actually. I found that out from the person that was after me, said that I was being open heart surgery on Dr. Hahn on this morning, but the person who was prior to me had complications, and so they were late for my surgery. I was the person in front of you. What are you talking about? So that was my first tidbit, that the hospital and my sister wasn't telling me all the information. I also know that right coming out of the open heart surgery, there was something that happened. Nobody told me anything. I was put in the non-ICU unit. A different sister showed up, and I was vomiting out of control, and I was very, very sick. She then caught on that something had happened. And then I had complications all that week with getting my blood coagulated. I got discharged, went to my sister's for a couple weeks. Several weeks later, I flew back to Colorado with my 5-year-old daughter, I think she was, if this was 2006. Yeah, she was 5. And I suffered 3 mini strokes 3 days in a row. Well, yeah, right. The first one was at home. I think the second one was at home. And then they put me in, and then I had the third one in the hospital. I stayed in for a whole week. And by the time we got out, they had to put me on something like 18 to 20 milligrams of Coumadin, which would kill 99% of the world. And they told me, there is a chance this could go wrong tonight, and you will bleed out of your nose and your eyes and your oral openings. And there's not going to be a lot we can do, but we've got to do something. And they had called in national experts to find out I had a blood coagulation problem. And the national experts said, put her on the 18 or 20 milligrams. I remember telling Rosalind, my roommate, you get up all night long to go to the bathroom. Would you just please peek over the curtain and make sure I'm not bleeding out my face tonight? It's just so you can call the nurses sooner. Not that they could do a whole lot. Anyway, I ended up getting through the night, and the doctors were stunned in the morning that my blood numbers just maybe 2 points, something ridiculous, slightly moved. And he's like, that dose would have killed anybody else. And she's still not even responding. So then they knew I had a responding coagulation issue. They continued giving me that dose for so many days, and I became less fearful. And then finally they found that I had to be not on that high a dose, but they needed that dose to kind of kickstart the pipes. And then they were able to reduce me to 10 to 12, which is still a really high dose. Okay, get past that. I get discharged that night, and my heart equipment in my box goes off. And it's late at night. I had just gotten home from the hospital. I hadn't been with my daughter for 7 or 10 days for this hospitalization. And the doctor tells me I had a VTAC. Didn't understand what it meant, had to go back in. It's life or death. You could die tonight. So I'm just like, oh my God, I just got over this. So I just assumed the doctor was wrong. I panically kept calling my primary doctor, which at 10:30 at night, he responded and said, you lay down on the couch, Francesca. Let me go get the records from your walking Holter monitor, and let me see what I find. And he calls me back and said, I'm sorry to tell you, honey, you had a VTAC. But it's 10:30 at night. I'm going to let you stay home with your kid. And we'll make an appointment at the office for you tomorrow. I personally believe, knowing you, having been an athlete, that you have been having VTACs all along that are unsustained, and you did not know it. You are one of the few people who can have VTACs on your feet and not pass out. I normally just say, I feel dizzy. I feel like I'm going to vomit. I feel like I'm going to faint. I feel like this feeling, but I never knew what it was. And I've had those throughout my life. So probably I was having VTACs unsustained in my feet. I then, at that point, went into a massive clinical depression. On December 24th, I actually went back to the hospital, thought I was having a heart attack. They said, no, 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 no. And at that point, I was very depressed. And I went to see the doctor on December 26th, and he recognized that I was going into a clinical depression, that many of the medications they put you on for heart surgeries are depressants. And so the heart doctor always has to look for somebody who comes out of open heart surgery with depression, because the medication puts you there. Plus, this was a tall order. I started to see that I didn't want to go out of the house. I wouldn't go out at dark. I didn't want to cross the backyard because I was afraid of snakes. I didn't want to drive. I was scared to death that I was going to have these unknown heart attacks. VTACs is what they were called. And my phobia started to make me recluse in my apartment or in my house. No, I think no, I was living upstairs. I had the whole house. Okay, I'm having to recall because this is going back quite a bit. I ended up, hang on a second. This probably went on for a year. You figured the open heart surgery was November 8th, 2006. And I moved to Italy October 30th, arriving the 31st, 2007. I spent that whole year in my head until, that's right, now I remember, I started having flashbacks and body memory things, and none of it made sense to me, and nobody was telling me. What ended up happening was they had sedated me in the ICU because while I was on the ventilator, coming out of open heart surgery, my lungs would not take back over. So they had to keep me on the ventilator longer than normal because my lungs wouldn't, whatever they're supposed to do. So I had this thing for breathing out after the open heart surgery longer than normal. I remember waking up. My sister gave me a clipboard. No, that clipboard thing was later. I remember waking up and communicating to my sister I was going to vomit. She kept telling the nurse, and this is what came all the way through when my amnesia broke, and my amnesia broke, the surgery and the event happened November 8th. I had no knowledge of this event until June or July. So November, December, January, February, March, April, May, June. It was 8 months of amnesia. I got into therapy because all the pieces were coming shooting at me like slivers of glass. I had no idea any of this trauma had happened. Well, I didn't tell you what happened. I started vomiting on the ventilator. While all this was strapped in my face and my mouth, and I wasn't breathing for myself, I started vomiting in the ICU. But none of this became clear until 8 or 9 months later, when all of a sudden I went to my sister and said, what happened? What is not anybody telling me? And then she told me, and I argued with her and said, there's no way I could be vomiting on the ventilator. I would have choked to death, you know. And then as we continued to talk, all of a sudden on that phone call, the memory became clear. And I remember my sister giving me the bucket because the nurse said she doesn't need a bucket, which we didn't understand. There was a second hose that would suck up the vomit, but it was a really skinny hose compared to the fat hose for breathing. And I remember my sister giving me the bucket, and I remember going like this and vomiting and looking in the bucket, but there was nothing in the bucket. And I couldn't understand, but I was totally sedated. How could I be vomiting and nothing be in the bucket? And what I didn't know is there was a tiny hose that sucked up vomit in case this happened, but you had to be vomiting at a lower rate than how big the tube is or something, or you could get it going back into your lungs, which I was having problems with my lungs. So all I know is at some point they just shot me up and put me out. And putting me out, I guess, stopped the vomiting or me fighting the situation. So these are just the more open heart surgery, bag of worms, and then I went to Italy. I'm fast forwarding 100 years later. I have had migraines that have left me on the floor incapacitated, not being able to speak, not slurring, losing my vision, not having mobility. And one migraine in particular I thought was a stroke. And I kept trying to wait before I would let my daughter call an ambulance. And then I allowed her to call my girlfriend, and my girlfriend showed up, and my girlfriend stayed with me on the floor. I still thought like holy hell that I wasn't going to get an ambulance. And my body was paralyzed. I lost my vision. My vision went black and white and went in and out, was light sensitivities, and my speech was slurred. I did at one point see something like the lights were bright, but it was also what I was going through. I finally allowed them to take me to the hospital, and it ended up being a complex hemiplegic migraine, which paralyzed my trunk, not my limbs, slurred my speech, and took away my vision because the migraine was so bad. It was pinching down, acting like a stroke. So I found out, and I have permanent. That contributed to escalating my eye damage from my stroke, which I didn't tell you about. And that was 2018. 2006 was the surgery. Well, 2012, I actually had a stroke. I had an embolism stroke. Emboli is what they told me in Italy. And while I was waiting for my second heart surgery cardiac ablation for AFib running 223 beats a minute for 60 minutes at a time, I threw out a blood clot. Blood clot went in, hit my optic nerve, and busted behind my optic eyeball. Retrobulbare optical neurite. And when that happened, it was excruciating pain. I couldn't speak, I couldn't move, everything. Again, I thought that was a migraine, so I just got through the night, and then the next day my girlfriend took care of me in Italy, and then my vision kept getting worse and going out on me, and so I ended up getting into the hospital, and although they could not diagnose it, 4 months later I went to Rome and they did diagnose it. So 4 months after my stroke, I found out it was a stroke, although I didn't understand it was a stroke because they kept saying ictus, and I couldn't find the word for stroke, so I didn't know what it was. I would say it was an embolism, but afterwards I found out it was a stroke. So then you throw in, I was at the Columbine Public Library on the day of the Columbine shooting and helping the SWAT team all day, and the kids that were locked down there and the kids that came in. And then when the event happened at the end of the day, I walked across the field where there were bombs that the police had yet to find that there were bombs in the field, and I walked home to get to my car with another mom. So there's been numerous PTSD kind of issues and trauma medically that choosing depression, choosing to be recluse, choosing, I think it's called agoraphobia or something like that. Never had that, but I was starting to go down that path. And so initially, I had to do a lot of things to try to break away. And so it's not that I'm fearless. I am not fearless. I just choose life. And sometimes I've used Europe and Italy and international adventures as my way to break open the crusty shell of fear. So it was when I was speaking to Mary today, and I told her that there's a lot of women that have this do or die. I'm sitting on the couch waiting to die, not doing anything because things were happening as I got older, and then COVID came and it just brought out the worst fears in people so that they have the ability. I mean, we're not talking mental illness or personality disorders, which is, please, that's not my arena, and I don't want to attract that type of clientele. But there's plenty of us that are healthy, but we have insecurities, and COVID, along with old age and a few medical issues, just throw it in a pot, mix it up, and it's called a disaster pie. And so this is what I've done since 2006 to reclaim my life. So I think it's, I don't know, maybe 17 years. And I'm not fearless, but I do travel and I live life passionately and aggressively. And that is part of this whole coaching process of me trying to help women who specifically want a different type of cultural experience in Italy or Europe. And I'm really excited. I've had tons of individuals and couples and small groups come informally, but this is the first time that I've got an entire group there'll be 6 with me. At times it'll be a max of 7, and then sometimes it'll be only 5 to 7 depending upon what we're doing. But I'm really excited to see what kind of growth everybody gets out of this experience. So it's not just a vacation, it's a eye-opening, life-changing experience. So anyway, wanted to share that. Hopefully I can get this video up. I can see it's 20 minutes now.